Okay.
Thank you so much, Steve. Good morning, all. Thank you all so much for taking time off from your schedules to be here. It's wonderful to see so many of you all again. Difficult to follow that wonderful lecture, but I think a lot of the things that we heard there are very similar to the themes that we have in the healthcare division of CITRIS. I have to say, before I get started, over the last, since January, it has been an absolute pleasure and a delight to be working with Steve DeMello. We feel so fortunate that Steve came over and joined CITRIS, and I can't tell you how much I've enjoyed working with him and just what an unbelievable talent he is and what he's brought to CITRIS. And I think that's clearly evident in the quality of work that we are doing and hope to continue to be doing. So, Steve, thanks so much. It's always great to work with you. This is what we wanted to present. We wanted to present to you where are we with regards to healthcare at CITRIS right now. I mean, this is our third scheme meeting. When we first started it was, hi, we're the healthcare division of the healthcare research arm of CITRIS, and we want to do something. Well, it's been 2 years now, going on 3 years, and we have been able to accomplish, I think, some wonderful projects, and we've laid together an infrastructure at the various directors' meetings. We've really tried to establish a healthcare strategy at CITRIS, and I just want to review that with you all and show you all where we are. Obviously, the 4 campuses are crucial to the healthcare initiative. Each one of the campuses has its own strengths, has its own talents, and it's really working those talents together. This is very much a 4-campus research effort. One campus can't do it. We're lucky that being here at Davis that we have access to the clinical arm, but one of the things I clearly want to stress to all the CITRIS researchers, all the students that participate in CITRIS, is that you also have access to this clinical arm. On the 4th floor of this building here, we have our Innovation Center, which is very much a part of CITRIS Resources, which we invite all CITRIS researchers to come to UC Davis. You have lab space here, you have working space here, and we're right across the street from the hospital. So whatever clinical aspect of it that we hope to move different projects onto, we can, and we will. So Steve has been really crucial in helping put this together, and I think coming from his background, he was really able to help us focus what we wanted to do and how we wanted to do it here. And I think, one, we always look at the compelling need. We say, okay, is there a need, is there a niche that needs to be filled, and how can technology, how can what we're doing at CITRIS fill that need? And one of the things that I've enjoyed from my first day at CITRIS and continue to enjoy is seeing what the different campuses do, what you all do in your basic engineering labs, that you all take so much for granted when it comes to healthcare. I remember almost my first day with Ravi at CITRIS and talking to someone and in their lab, and they said, well, you're in healthcare, so all this technology, I'm sure it already exists in healthcare. We're probably a little bit behind the curve. And I keep reminding them, you have no idea how early on we are with regards to bringing technology into healthcare. Right? One of the things I'm continually amazed by is a study that was done at UK when we last had our CITRIS Europe meeting in '06, I believe, was that it takes an average of 5 to 7 years of off-the-shelf technology that's available before healthcare will even look at adopting that type of technology. Healthcare tends to be a very late adopter of technology. Now, we'll buy the newest, latest scanner. We'll buy the very high-priced molecular scanner for diagnostics, but what's amazing to me is that we'll write the results of that on a 3x5 card and put it in someone's pocket. That's the state of technology in healthcare. we talked earlier this morning about Kaiser and what they've done. One of the examples I use over and over again, a few years ago, Kaiser's main marketing and new technology innovation was, you can email your doctor. Wow, that's revolutionary, isn't it? It was revolutionary to healthcare. What it brought forth was incredibly revolutionary in the fact that people had increased access to communication to their physicians, which brought about a decrease in what would be termed unnecessary office visits, and that patients just wanted more information. But we're adopting this type of technology, a minimum of 5 to 7 years after the rest of the world is already using this type of technology. So when we talk about technology-based innovations at CITRIS, we really want to push that envelope. We really want to do projects that are taken, whether it be cutting-edge technology you're doing in your research labs or technology that you already know is working in other types of business, whether it be supply chain, whether it be in robotics, other aspects of basic engineering principles that is already well established. Healthcare likely hasn't adopted that. And I think that is some of the projects that we can bring forth quickly into healthcare and show their use. Now, one of the things that I'm really excited about is this concept of a visible business model. Or a viable business model, and that's something we hadn't had. And after discussions with Steve and his close ties with the various business schools, and specifically the business school at Berkeley, on the Berkeley campus, we really need to do this early on, and we really need to work with our students, work with the students at in the business management schools to bring them into the fold to look at this. So these aren't just one-off projects, but these are projects that can turn into, whether it be larger scale projects, or it can even be spin-off companies for the students and the researchers as they move on. And then we can't do anything without having a supportive public policy. And I think we're very fortunate to have a strong alliance with the California Center for Healthcare Policy that we have here, that Dr. Nesbitt and Ms. Sandra Shuri helped found, that the California Healthcare Foundation has funded. I think working in close proximity with them, having them more involved in CITRIS, which we've already done and we will continue to do, we will work that policy arm, because obviously it's essential to make those policy changes and to have that policy dialogue so the types of changes that we're talking about, the types of technology innovation we're talking about, can really have a foothold in healthcare. So our transforming ideas, well, how are we going to go about doing it? Well, obviously, you all with your incredible number of postdocs, graduate students, undergraduate students, generate project ideas. The goal of CITRIS is to continue to do what CITRIS has been doing, what Paul Wright has done such a great job of making sure that we have that type of seed funding available, is to have a seed funding process so we can get those pilot projects, so we can get a proof of concept, have some initial data, and then take those successful projects and develop them into serious core projects, and then go after large-scale funding, whether it be the National Science Foundation, whether it be the NIH, whether it be AHRQ, other large research funding organizations, in order to move those projects and successfully launch those projects. This is the methodology, and this is the stream that we hope to be using. Again, as with all CITRIS presentations, this will be in the CITRIS website, so you all can refer to these slides as well as this process. So where are we right now? Where is the state of healthcare research at CITRIS? Well, I think we're incredibly fortunate due to the quality of researchers and the quality of work that is being done, that we have 27 active projects within the healthcare realm of CITRIS. They're either supported by seed funding, or seed funding internally through CITRIS, or through outside funding. and obviously they all have CITRIS faculty at the head of those projects. Those projects have been broken down into 4 major themes: telemedicine and remote health. Again, a key interest of ours, and one we hope that we will continue to grow, especially after you hear the next presentation on where we are with the California Telehealth Network. Sensors and networks. I think the fact that we hosted the Body Sensor Conference at Berkeley really, I think, brought forth the especially the recognition from the clinical side to the importance of this: software, services, and materials and devices. So obviously some of these projects are simply proof of concept projects that we're hoping that with the CITRIS seed money that we can collect some initial data and move them forward, but there's definitely funding needed to complete the core research arm as well. So here's where we are. All right, with regards to our 27 projects that are currently in the pipeline, and this is where they are in the pipeline. And I think a lot of this has been through, that these projects could not get to where they are had it not been for the dedication of the faculty, many of you who are here, and also due to the resources that CITRIS brings. CITRIS, as I like to say, is a neutral sandbox where people from different realms can come, play. We bring resources to it. It is Switzerland. We have alliances with all of you. We are dedicated to all of you, and we really want to make sure that all for researchers from all various realms, clinical realm, all the basic engineering disciplines, realize that CITRIS really wants to be a resource and really wants to be a fertile ground for you to develop your initial projects, and we will do everything we can to help you move those projects forward. I think one of the great examples of that is, if you all are available during the lunchtime, is to see our advanced imaging project that we have upstairs. The CITRIS Advanced Imaging Project really is something that bore out during the second scheme meeting, had some meetings with several of the researchers here, along with some of the clinicians, really able to bring something that was in the basic science realm in the engineering schools to look for a healthcare application for it. Thanks to seed funding from CITRIS, we're able to bring this project forth, and we hope to, and we're now in the process of collecting some initial data so we can search for long-term funding for this. So the state of healthcare at CITRIS, again, I hope you see we actually do have active and vibrant projects in the pipeline that we're using the seed funds appropriately to get these exciting projects to a state where they can then become independent and run. Really, what we want to do is we want to strengthen the early stages of research, and we want to allow that to be successful so then you as faculty, you as researchers can concentrate and work with us to help develop the later stages. And what we're really hoping for is that we can establish some long-term success with regards to the entire research project. So with that said, I'd like to turn the podium over to Steve DeMello to continue on with where we are with CITRIS.
Great. Thank you, Javeed.